A COVID subvariant that's on the rise around the world appears to be more infectious. But health experts say there's no indication the strain, called EG.5, cause more serious illness than previous strains. Today, the World Health Organization updated its recommendations for handling the virus, calling it a variant of interest. The agency says it is especially concerned about a lack of data and reporting.
3 months ago, I declared an end to COVID-19 as a global health emergency, although I said that it remains a global health threat. Since then, the number of reported cases, hospitalizations, and deaths globally has continued to decline. However, the number of countries reporting data to WHO has also declined significantly. WHO continues to assess the risk of COVID-19 to global public as high. The virus continues to circulate in all countries, continues to kill, and it continues to change. WHO is currently tracking several variants, including EG.5, for which we are publishing a risk evaluation today.
So now, for more on this new subvariant, we're joined by Jennifer LaGrasse. She's following the story for us from Windsor. So Jennifer, what do we know about this new strain of COVID?
Well, it's called EG.5, and it's an offshoot of the Omicron subvariant. The Public Health Agency of Canada tells us that between May and July, it was detected at least 36 times in municipal wastewater samples, and that between July 30th and August 5th, it likely made up around 36% of cases seen in the country. In the United States, it's also very quickly become the dominant strain there, so making up the majority of cases. And as we know today, the World Health Organization has upgraded it from a variant under monitoring to a variant of interest. So that essentially means that it is circulating more than other subvariants at this time, and that it's something that's going to continue to be monitored and assessed for those public health risks. But what we're hearing from experts is that while it does appear to be more infectious and better able to kind of sneak past our immune defenses, it's not something that they're seeing, at least from the evidence right now, that can really cause severe illness.
So it's something to certainly keep a close eye on, but I'm not significantly worried about it at this point because it's on the same trend as we've been seeing some of the other subvariants that are circulating.
And so while experts think that we're going to see an increase of cases that are EG.5 come the fall time, they don't think that we're going to see that huge wave just because Canada has a lot of immunity at this point.
So then for people planning to get the booster this fall, will that cover this subvariant?
Yeah, so it should, at least according to the experts that we've spoken to. The vaccine booster that is going to be coming out in the fall is likely going to be monovalent. So that means that it's going to target Omicron and its subvariants. And even if it's not a perfect match, what we're hearing is that this will offer the best protection, so preventing against that severe illness, things that are hospitalization or death in this case. But doctors told me that if you are someone who is at high risk, so if you're elderly, immunocompromised, or you have another chronic health condition, what you should do is speak to your family doctor about whether you should get the current booster that's out or wait for the fall booster that's going to be coming out.
I think we know how to live with this virus, but living with the virus means not an indifference, but prudence and making sure that we use all the tools that we have.
And some of those tools that we have are things like masking in crowded spaces, staying home rather if you are sick, and then also getting that fall booster.
Thanks for this, Jennifer. That is the CBC's Jennifer LaGrasse in Windsor, Ontario.